السلام عليكم ورحمة الله وبركاته. الحمد لله رب العالمين والعاقبة للمتقين. الصلاة والسلام على أشرف المرسلين سيدنا محمد وآله وأصحابه أجمعين. Welcome viewers to another episode of Health Matters, a comprehensive chat by the Islamic Medical Association of South Africa, health professionals trying to serve the Almighty through various forums, and this one here, a forum of education and empowerment. It's our medical program, our weekly slot, and we're happy to have you again with us. Tonight, a very interesting topic. We're expecting a lot of calls from you. We're going to be discussing diabetes, and in our studio today we have a guest, Dr Haroon Tayob, a specialist physician with a special interest in diabetes mellitus and kidney disease nephrology. Assalamu alaikum, Haroon.
Wa alaikum assalam, Yakub, and assalamu alaikum to your viewers. And may I also just take this opportunity of carrying out a promise that I did to my grandchildren. I promised I'll wave to them, so at least they can wave back, and I said I'll probably be seeing them too. Thank you.
Okay, that'll be a good happy moment for Haroon's grandchildren. We're discussing diabetes today, and as we have always started off, we take instructions from the Quran, and within the teachings of the spiritual teachings given to us by Allah subhanahu wa ta'ala through our guided book. And Allah says in Surah Al-Baqarah, O believers, eat of the good things we have provided you and be grateful to Allah. It is Him whom you worship. And earlier, and it follows on that, He has only made unlawful to you the carrion and blood and the flesh of swine and the animal that has been slaughtered by calling a name other than Allah. So in the spirit and in the comprehensiveness of what we are talking today, we're going to be talking about diabetes, and diabetes is a lifestyle disease, and Dr. Tayob will be talking about prevention, and one of the prevention and one of the key elements and cornerstones of the treatment is obviously to eat correctly and lifestyle. But here the strict instructions from the Quran guided to us is a comprehensive and a spiritual teaching that we have to eat of what is good for us. Not only good in terms of attaining righteousness, as the ayah has said, but also to get closeness to Allah through various means. And it's not just the physical side, which we're going to be talking about today, but also the spiritual and mental is all linked into one component. And to eat correctly, not only for the prevention of disease that is physical, but also spiritual and in terms of your overall lifestyle. And if we take that particular criterion and that particular guideline straight through, then we'll be preventing a lot of diseases. And the one that we're talking about tonight, diabetes, this is absolutely relevant. Any comments on that, Haroon?
No, I think, alhamdulillah, what you're mentioning is very important. And especially as Muslims, I think it is important for us to realize that Allah Ta'ala has guided us in terms of our diet and our lifestyle. And tragically, we unfortunately, as we will hear later, that there are many Muslims in various parts of the world and also in so-called Islamic countries that have a very heavy burden of diabetes. And we ask ourselves, how is that possible when we have the Quran and the Sunnah as our guide? Then we've got to ask ourselves, are we really understanding what this religion is all about? So I think it's important, very important, Yakub.
Jazakallah khair, Haroon. Okay, now diabetes we're talking about, it's, the figures that we're looking at the moment in terms of incidence are staggering. We are really shocked about incidences of infectious diseases like TB and HIV in South Africa, but a non-communicable disease like diabetes, where it is not spread by germs, where we are in control mostly ourselves, the figures are really, really mind-blowing. Just to tell you that the International Diabetes Federation, about 10 years ago, they predicted that by 2030 we will have 350 million diabetics. That in itself is history now, because as we sit now, we've already got 360 to 370 million diabetics, type 2 diabetics, which will explain that concept worldwide. And now the prediction for 2035 is 560 million diabetics. And again, just looking exponentially in terms of the main reasons why diabetes is becoming an epidemic worldwide, if it is not really an epidemic already. Even those figures of 2035, when we look back on it, if we don't control and institute the measures that we'll learn about, some of it tonight, we'll have probably 1 billion people. Do you agree, Haroon?
100%. In fact, if you look at South Africa, first of all, in our earlier education, at varsity, etc., we were all taught that diabetes is common amongst Caucasians. But in fact, if you look at our own country where we've got 50 million population, the largest of which is the black population, the incidence of diabetes is on the rise. And this is on the rise since after 1994. And of course, this tells you that there's a change of lifestyle and that in fact all this would have been preventable had we looked at that and educated our people against the change of lifestyle. It's fine on the one hand to keep up with the times, but when you take the wrong road, you're only just causing problems for yourself.
Talking about South Africa, I mean, our figures, I mean, they vary, but reliable sources are telling us that there's 3.5 million diabetics in South Africa, established diabetes, and those that have got what we call impaired fasting glucose, a concept of pre-diabetes, when you measure your fasting sugar, it is between a certain level of 6.1 to 6.9, they become diabetic if they are not controlled beforehand, before medication is instituted. And those alone in this country at the moment, we're looking at figures of 5 million. Haroon, so perhaps this is the point where we can perhaps start our discussion. What is diabetes? Patients come to us and they tell us, doctor, I've got sugar. Or you're sitting at a wedding or at a social function, this sugar is really killing me. What is this thing about the sugar?
Right. Diabetes has been divided up into two forms of diabetes. One was called diabetes mellitus, and the word mellitus actually means honey or sugar tasting. And this is the diabetes that we are talking about. The other one is diabetes insipidus. It's not for discussion today. And that is why we distinguish between the two by saying diabetes mellitus. But generally, when we speak of diabetes, we're obviously talking about diabetes mellitus. Now, when we talk about the sugar, so what actually is the problem? Well, this problem has been defined from the beginning of time as a situation in which the body is unable to utilize the sugar effectively. Now, what is sugar required for in our body? Sugar is required for energy. If you think of your motor car, petrol is required for the energy for that motor car to move. In the same way, sugar is required for the energy of our body so that we can move and so that every part of our body can move. The heart beats, needs energy. The kidney works, it needs energy. The brain functions, it needs energy. So sugar is a vital component of our body. Now, actually what happens in diabetes, just for those of you who don't actually understand the principles of diabetes, although we talk about sugar, there is the other impact of diabetes, and that is the effect that diabetes has on your other components of the body, including your fats, especially your fats and your proteins. So what actually happens, let me just take you through a person who is having a meal. Carbohydrates, starch, or sugar. These are the components that produce what substance called glucose in your stomach. So when you eat any of these three, there are enzyme systems in our stomach and of course in our mouth, so it's important that we chew our food. We chew the food in order to break the complex compound into a very simple compound. Once it enters your stomach, it then becomes converted into the simplest form of carbohydrate, and that is called glucose. So that's why you will find whenever they talk of diabetes, they will explain to you or ask you, what is your glucose level? All right, so the glucose is now established in your stomach. So now what happens is that the glucose gets absorbed in this simple form, and it gets into your bloodstream. And what is the function of our bloodstream? The function of our bloodstream in this particular situation is to take this glucose to various parts of our body. For example, I told you about motion. Let's take muscle. The glucose has to go to the muscle. Now the muscle has got a wall. Nothing can get through that wall unless the door of that wall is opened. So the substance, a hormone called insulin, which is produced by the pancreas, opens that door so that the glucose can enter that cell. Once the glucose enters the cell, the muscle itself will utilize that glucose into energy and will be able to move. So, where does the problem come in with diabetes? The problem that comes in with diabetes is that when this glucose gets to that muscle cell, if it cannot get into the muscle cell, it will accumulate in the blood. And if it accumulates beyond a certain level, then we call that diabetes, and the person is a diabetic.
So at that point in time, you're measuring the sugar, the glucose, and then you identify the person as diabetic. Okay, so let's move a little bit backwards now to what will then cause that insulin not to work, because that's what we're talking about. Is that correct?
Exactly, exactly. Now, what is wrong with that key? Like I said, you need the key to open the door to allow the sugar to get into the cell. The problems with the key are variable. One is there's some defect in the key itself. The other one is there is a defect in the production of that insulin from the pancreatic gland. Either the production is totally absent or the production is incomplete or insufficient to for that body or for that requirement of that particular body. And finally, very important component is that that key can't open the lock because there's something wrong with the lock. That means there is a resistance, what we call about insulin resistance. And that means there is a resistance at the level of the cell to allow the glucose to move into the cell where it can be converted into energy. So if the door does not open, the blood will continuously flow and continuously come back to that muscle and will never be able to get in, and therefore your blood sugar levels will accumulate because it will not be able to be released into the cell.
So that sugar is going to cause problems in various cells, and the cells make up organs of the body. And then therefore you're going to have diseases in various organs. But now before we get to that point, how do we then prevent this particular insulin glucose mechanism to work, and what's causing it not to work? We know that one of the predictors for this is basically obesity and overweight, and we're normally telling our patients that don't be overweight, but at the same time, within our Indian population in South Africa, and the figure is that 11 to 13% of South Africans are diabetic. All right, so that's a high figure, a very high figure, and we have a genetic predisposition to this, and then we're making it worse by obviously not eating correctly and picking up weight, and the obesity being a key role and one of the cornerstones in this thing. So can we start the discussion at that level before we get to the complications?
Sure. We as Muslims, often when we see chubby babies, we say mashallah. Unfortunately, that would be the wrong time to say mashallah. Because unfortunately, while the baby might have chubby cheeks and a big stomach or a big body build, that baby already is vulnerable to diabetes. Because it would appear that whilst we agree that there is a very strong genetic component, now the genetic component means that basically a parent, one or more parents or uncles or aunts, or running in the family of the first generation, there is a problem with diabetes. Now this gene gets transferred from the mother or the father to their children. Some will carry the gene and will not have any problem, but unfortunately there are others who will have a problem. So what is it that will determine that those who have got the genes can have the problem, and what is it that will determine that those who have the genes will not have the problem? Well, it appears that if you have the gene, then there is the component what we call lifestyle that will actually, unfortunately, trigger the development of diabetes. And that change of that lifestyle refers to our eating habits, and it also refers to our ability to utilize energy, that we eat food and to utilize that and rather not be sedentary, what we call sedentary or lazy or sitting around, not necessarily lazy, but somebody who's not moving all the time. So these are the factors that will determine that the genetic component will now make you a diabetic. In contrast, you've got those people who have got the genes, but they've been very active, they've been very careful about their diet. They don't smoke. Smoking, unfortunately, is one of the factors that will also predispose to the development of diabetes in those who are vulnerable. So these factors, if you eliminate these factors from your lifestyle, then we can prevent diabetes. Unfortunately, the bad news is that once you have established diabetes, then it is too late. Then it is a bit late to start saying, oh Allah, help me. Better to say that before it comes on. Oh Allah, I'm reminded of the verse that Yakub has read. And oh Allah, help me to be able to stick to that diet and be careful. Especially if you know that your parents, one or other, or family members has got diabetes. Then you know that you are a potential. And therefore it is more important that that type of individual should take care more than any other persons to prevent diabetes.
So there we have it. The theme is the prevention of the diabetes. We will be opening up our lines, and I'm sure a lot of you are itching to get in your calls. And we'll be taking an ad break, but just to remind you that the line number will be 011-086-7701 or 2 or 3. I repeat, 011-086-7701 or 2 or 3. So get your calls coming in. We're taking a short ad break now, and we'll be back with you shortly. Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome back to Health Matters, a comprehensive chat. Tonight's episode is on diabetes. We have Dr. Haroon Tayob, a diabetes specialist, and also an interest in kidney disease, which is one of the complications of diabetes, which we may be able to touch on. The lines are going to be open shortly, 011-086-7701 or 2 or 3. So please call in and Haroon will answer your calls. While we're waiting for the calls to come in, Haroon, now we spoke about prevention. What is actually going to prompt a patient to actually go to a doctor to say, you know what, I think I may have symptoms of diabetes? Sometimes when they got established disease, they got complications already, but we want to catch them early. Right? So obviously those that got symptoms, and sometimes some things that alert you, because we know there's some overt symptoms like, excessive thirst and loss of weight, and sometimes some indicators. You want to perhaps touch on that?
Sure. And just to correct you there, Haroon will answer, inshallah. Right. Okay. Yeah. The problem with diabetes is, like you said, it's sometimes not diagnosed until too late. Now, what would make you suspect that you have diabetes? I think the first thing that you got to do is, like I said earlier, if you have a family history of diabetes, consider yourself as a potential diabetic. Have a regular checkup. What do I mean by a regular checkup? Well, they say diabetes becomes more obvious or appears once you've passed the age of about 30, going on to 40s especially. So once you're reaching that age group and you've got a history of diabetes in your family, it's such a simple test to be done. You can either test your urine, or nowadays we check bloods. And I think that this is essential for those of you who have got a family history. Those of you whom I can't see, but you can see me, you can see yourselves as to whether you're overweight. If you have that physique, then I won't say alhamdulillah, I won't say mashallah. I say, look, get yourself checked. It'll be worth your while. Because if you pick up diabetes early, or you pick up the possibility that you're developing diabetes, by just a simple change of lifestyle, you could actually prevent that. And especially if you know members of your family that are diabetic, you know what complications we're talking about.
We've got our first caller.
All right. We're going to take our first call and then we'll continue.
Okay, sorry for the interruption there, but welcome to the first caller. Assalamu alaikum.
Walaikum salam.
Can you just speak a bit louder?
Walaikum salam.
Yes, go ahead with your question, sister.
I am a 52-year-old female that has just been diagnosed with an insulin resistance and also being pre-diabetic. I have a mom that was diagnosed with diabetes in her adulthood, and I never ever thought of mentioning it to the doctor that there could be a possibility that I could be diabetic. I've suffered symptoms with dryness in the mouth and all the other symptoms that you've spoken about. And I'd like to know, apart from the lifestyle change, what possible damage could have been done for it to have been undiagnosed for such a long period of time? And how do I sort of deal with this in my years ahead and menopause?
Can I ask you, sister, are you, from your weight, how are you, do you consider yourself as being overweight?
Yes, I would.
You would
But having said that,
yes,
I've only had the weight increase over the past 5 years, which could possibly, according to the doctor, could have been attributed to the menopause.
Mm-hmm. Mm-hmm.
And I am on hormone replacements as well.
Okay, that's good. Now, you see, what I mentioned earlier was that a patient like you, who's got a family history of diabetes, from that age of, like I said, 30 to 40, you should have already been looking out for this possible situation. But alhamdulillah, it seems like they have picked it up in time where you've only got a, what you're referring to as an insulin resistance, without necessarily being a full-blown diabetic. Am I correct?
Yes.
You are not a full-blown, which means that what you're saying is they've done blood tests on you, and your fasting sugar is not more than 7, and your post-meal sugar is not more than 11. Has that been done on you?
Yes, it has.
Okay, so good. So we know therefore that you are not a diabetic as such, because those were the levels that you would need for us to diagnose you as diabetes. So we say that you might have what we call an impaired glucose tolerance due to your insulin resistance.
Okay.
So what is actually happening is that because of your insulin resistance, your sugar that you eat or absorb into your bloodstream is bypassing the cells. It's not going into the cell to be utilized for energy. Okay, do you understand that aspect?
Low energy level.
You have?
Low energy levels.
Yes, you have low energy levels. So do you understand why? Okay. Then secondly, a lot of that sugar overflows, and are you passing it out in the urine? You're not, because you're not yet fully a diabetic.
Okay.
But if you were a diabetic, you'd start passing that out in the urine, and there you'd be throwing your energy out of the body. So that's why you can also become weak and tired.
Yes,
okay, now the thing to do is to ask ourselves, is there something wrong with your insulin? No. The probability is that it is this overweight that is contributing to the insulin resistance. Now what actually happens, sister, in this situation is that you are not yet a diabetic because your pancreas is able to compensate for this resistance. So what will happen is if they measure your insulin levels, they might find that to be high.
Okay.
So what happens now is your pancreas starts producing extra amounts of insulin to overcome this resistance at the level of the cell.
Okay.
You understand so far?
Gee,
Okay. So now, at some stage, sometime, that pancreas is going to become exhausted. It's like, you know, you flog a horse.
Okay.
If you keep flogging that horse, he must become exhausted and collapse.
Mm-hmm.
So similarly, the pancreas, which is situated in your body, is being flogged and being told, please produce more insulin in spite of enough insulin in your body, but the problem is the resistance. So the body reads this as a deficiency of insulin, and the pancreas is overworked. When it becomes exhausted up to a certain point, then diabetes will become manifest. So what we want to do with you now is we don't want to reach that stage of exhausting the pancreas. So the first thing that we need to do is, like we said, major contender here is the overweight. Whether it is due to whatever causes, but if you reduce your weight, there is a very, very strong possibility that you will reverse the whole insulin resistance. And once you reverse the insulin resistance and you stay that way, there is a very strong possibility that you will not become diabetic. So, sister, what you need to do really is you need to go to a dietitian already at this early stage.
Okay.
And you need to go to a biokineticist or a physiotherapist or a gym where they will teach you exercises. Whether you do aerobic exercises or resistance exercises, they will be able to help you in terms of the amount of exercise. But the cheapest exercise that I can tell you is walking.
Okay.
It's free, but unfortunately may not be safe. So make sure you do it in an area that is safe. Don't turn around and say, hey, that Dr. Tayob told me to do a walk and I got hijacked. That's not my fault. So look after yourself and do it that way.
Marv, that I have with that is that I also have arthritis.
Yes, yes.
And also my thyroid is underactive.
Okay, so your thyroid is underactive. You need to correct that because that thyroid problem will give you cholesterol problem. And diabetes will give you cholesterol problem. And cholesterol gives you problems with strokes and heart attacks. And diabetes does the same. So you, therefore, are the one that is more important that you go and see a dietitian who must help you to control not only your sugar, but must also help you to control your weight, and very importantly, also help you to control your cholesterol. So you need to have cholesterol levels done regularly, and I think you need to see your own doctor in terms of regulating your thyroid, which needs to be tested every few months to make sure that your levels are correct, and of course, checking your cholesterol levels. So I think you need to start immediately with a lifestyle change, meaning
Yes.
go to a dietitian, go to a gym, get yourself sorted out, and inshallah,
Amen.
you will be improved. And inshallah, if it's not too late, you will not become a diabetic.
Jazakallah khair for your call, sister. Very interesting call. And Haroon, you addressed quite a few issues there. Obviously, and again, we're coming back to the cornerstone, a patient that has not yet had established diabetes, but in that category, which we used to call pre-diabetes, impaired fasting glucose. So perhaps we're going to touch on that. Perhaps we'll be talking about that again if we don't get other callers. And we were at that point where we were talking about how the diagnosis is made, and perhaps we can just continue from there.
Yes. So as I explained to the sister, that if your sugar is not entering your cell, you're not going to have energy in your muscles. So you're going to become lethargic, and you're going to feel listless, and you're going to pass the sugar which is accumulating in your blood. It will pass through the kidney and it will be peed out. So what are you peeing out? You're peeing out energy substance. Imagine taking the petrol and not pouring it into the tank. The car can't move. So the same thing happens to you, that you will not feel energetic and you'll feel weak and tired. And you're losing calories. So your weight will go down. Now, but that's not the ideal way of reducing weight. So don't develop diabetes to reduce weight, because that weight loss is a sick weight loss. It takes away not only the fat from your body, but it takes away good quality cells, muscles, etc.
We have another caller. Assalamu alaikum wa rahmatullah. Assalamu alaikum.
Assalamu alaikum.
Can you go ahead with your question, sister?
Yes, I do. I have a 2.5-year-old granddaughter who is diagnosed type 1 diabetes.
Go ahead, sister. What's your question?
I can hear my
I think you need to switch
question
off
on
your
the air.
TV, or just make it a bit, to turn your
Okay.
TV down a bit, and then you can
Turn my TV down. Okay, turn.
just turn your
Yes,
TV
sorry
down and you
about
can
that.
hear. Yeah. So go ahead with your question.
Yes. She's 2.5 years old and she was diagnosed type 1 diabetes. And she's now on a short-acting insulin, and she's now 5.5 years old. So I would like to know what caused her pancreas to fail.
Is that your question?
Yes.
Haroon?
Sister, where do you live?
We are in Durban, prospecting.
In Durban.
Yes.
So we will send you to Norway to get the Nobel Peace Prize, or not the Nobel Peace Prize, the Nobel Medical Prize, if you can answer that one as well. Exactly what happens, we are not sure. But there are various factors. They say there is a genetic factor. Very difficult to actually, there is a genetic factor that does predispose these children. But there is also environmental factors. They say that perhaps the child might have had a problem in childhood, where she may have had a virus, an infection, something that in fact triggers off what we call an autoimmune phenomenon. Autoimmune meaning that your own body starts rejecting its own. So for example, what happens is the body starts producing soldiers against an enemy, like the pancreas. Not realizing that the pancreas is not an invader, it is part of your own body, but unfortunately the body is recognizing your pancreas as an enemy and it's producing soldiers against this enemy, and these soldiers are called antibodies. So you know, if you like, sometimes you know you get type 1 diabetics very early in childhood, like your particular granddaughter, but you can get type 1 diabetes later in life as well. And sometimes it's so difficult for us to decide whether you're a type 1 or a type 2, and it's important because you know, and I'm sure you realize this, that the type 1 diabetic cannot be without insulin ever.
Yes, no, that's
absolutely true. Dependent on insulin. In contrast, the type 2 can manage with just pure lifestyle changes.
Yes,
right.
No,
now this child can benefit from lifestyle changes because she will be active, she'll be healthier, she'll have more blood flowing to all the organs, and we may in fact prevent other complications of diabetes. But unfortunately, this child lacks insulin totally. If you remember, when I talked earlier about the concept of diabetes, I said that it's either due to a total lack of insulin, or there may be some reduction in the insulin level, or it may be the insulin may be defective. In your situation, your granddaughter, there's total absence of insulin. So, the important thing is that this type of a child needs to be, she needs to attend a specialist center. I would recommend
that's
that.
what she is doing.
And she would attend what they call groups. You know, what do you call that? Group
therapy.
Group therapy with younger diabetics, so that they begin to understand each other. Because unfortunately, these kids can become very depressed.
Yes, no, that's true. She is involved in a group therapy.
Excellent, excellent. What you are doing is brilliant.
She is seeing a specialist.
Yes.
Who is an endocrinologist.
Oh, alhamdulillah, alhamdulillah.
Yes.
And you know what? Endocrinologists, there are those who look after children, there are those that look after adults, then there are endocrinologists who specialize in diabetes for children. So you must choose carefully, and inshallah, we pray that this child of yours will grow healthy, and like I said, she will be an example to all the others around her, inshallah.
No, she is absolutely healthy. She's very active. But my concern was that will she ever grow out of this?
Unfortunately, I have to say at this stage, no. But let me also add that research is being done, and lots of research is continuing, and inshallah we always hope, because what Allah Ta'ala tells us in the Quran, for every disease there is a cure. So inshallah we hope on that, but at the present moment, unfortunately the news is not good. But look after her, nurture her, and inshallah she will be well. She can be.
Jazakallah khair for your call, sister, and we wish you the best, and inshallah Allah grant her shifa. We have another caller. Assalamu alaikum. Another caller. Assalamu alaikum. Okay, while we're waiting for that caller, it seems we have lost the caller. Haroon, at that point in time, you were discussing the diagnosis and the symptoms.
Right.
The patient must then go in for a simple blood glucose test.
Right.
Just a little bit of a procedure, finger prick test, blood test, what kind of test?
Right.
Oh, the caller is back. The caller is back, Haroon. Assalamu alaikum.
Wa alaikum salam.
You can go ahead with your question, brother.
Yeah, I've got very severe pain in my left arm, and it's 24/7. But I think it's a damaged nerve, whatever. But I went to several doctors, but they can't tell me what it is.
Are you a diabetic, my brother?
No, I'm not.
Oh, okay.
Okay, we're discussing diabetes, brother, at the moment.
And
so for your
only diabetes.
Yeah. So what you need to do is perhaps consult your doctor, and they can do a proper examination to find out what's causing the pain in your arm.
Yeah, but I went to several doctors and they can't tell me what it is. So I just want to know if you may perhaps can't tell me.
We can't make a diagnosis over the TV. You need to see a doctor who will examine you, do proper X-rays, examinations. You got to go for a proper thorough examination, inshallah.
Okay, inshallah. Thank you very much.
Assalamu alaikum. Haroon, so the diagnosis.
Yeah, so then also don't forget the other features or symptoms that one can develop that will make you suspect diabetes is that you get excessive thirst and you pass lots of urine. And this is because you're passing lots of urine, so you're losing a lot of water, and you're passing lots of urine because of the high sugar levels in your blood, and then you get thirsty because you've lost all this. So these are the symptoms that you should be looking out for. But don't forget, there are those, quite many, who don't have these symptoms.
Okay, we got a caller. We got another caller. Assalamu alaikum.
Walaikum salam. Yakub, how are you? It's Muhammad Adam here.
Alhamdulillah, Muhammad.
Alhamdulillah. I want to just say hello to Haroon Tayob.
Assalamu alaikum, Muhammad.
How are you?
Alhamdulillah, brother. You?
No, I saw you on the air, so I thought I would just say hello to you.
Thank you.
And I
so
need
nice.
advice on diabetes, but I won't ask on the phone to embarrass myself. I'd rather come to the private consultation.
Okay.
Jazakallah khair for your call, Mohammed.
Okay, no problem at all. Okay.
Right.
Thank you.
Assalamu alaikum.
Okay, right.
Okay, that's a colleague that was obviously congratulating Haroon, but we'll continue with our discussion.
Yeah, so the excessive thirst, the excessive urination, the weakness, the weight loss, wasting away, these are all these are indicators of the onset of diabetes. Then, of course, like we mentioned, if you're obese or you've got a family history, if you've had a stroke or if you've had a pregnancy with large babies, you must suspect that you're going to become diabetic. If you've had a pregnancy where you were diabetic, then you must suspect that you and maybe the child might develop diabetes later. So these are all the indicators that tell you, please go for blood testing. Now we come to the blood testing.
There's another caller. Assalamu alaikum.
Assalamu alaikum.
Go ahead with your
Can
question,
I-
sister.
Can I ask the doctor a question?
Yeah, sure.
Hi. So I'm diabetic. I'm 50 years old. I just had an HbA1c test done. My cholesterol is 4.6. My average sugar levels are 12, which I know isn't good. I am a bit overweight, but my concern is that I have developed on my legs and my feet it looks like little pink pricks of red spots on my feet and on my legs. Is that a concern?
First of all, Sister, Assalamu alaikum.
Walaikum salam.
Did you say you want to speak to the magician or the physician?
Both.
Okay, so because I'm not a magician, I'm not going to be able to answer your question because unfortunately you can see me, but I can't see you. And therefore I can't see those red spots except to say that this could be anything from related to diabetes or unrelated to diabetes. So my suggestion to you, if that is your concern, that you should see your general practitioner who might, if he's not able to diagnose it, refer you to a skin specialist. But secondly, I just like to take you on here. The way you said, I'm a little, you hesitated in saying I'm little overweight. So I suspect you are more overweight than you are prepared to admit.
Yeah.
So go for your measurements. There is such a thing called the BMI.
Yeah.
And that is the measurement of your height and your weight. And there's a formula that they can work out for you at any pharmacy or any doctor. And I think that if they tell you that your BMI is well above the normal being up to about 25, if you're more than about 30, then you're really in serious problems and you should seriously consider going for your exercise program and of course continuing with your medications. But
Can I ask you one more question?
if you've developed that rash recently, and especially if you've started some medications for diabetes recently, then the rash may be related to the tablets. So please do me a favor, go back to your doctor and rather let them check it out.
She's got one more question.
One more question. I'm on a long-acting insulin Lantus, and I'm on a short-acting insulin Apidra, and I'm also on glucagon tablets. What I am struggling with is my doses of the long-acting and the short-acting insulin. I'm playing around with it, but it's not really working. My doctor says to me, if my sugar levels are above 8 in the morning, then I should maybe increase the long-acting one by 2, which I did last night, and I actually woke up just before Fajr with a sugar level of 4.8, which makes me feel, it actually wakes me up. How do I get
What time do you take your Lantus?
Sorry?
What time do you take your long-acting insulin?
Just before I go to bed.
That's around about what, 10 o'clock?
10, 11 o'clock, yeah.
10, 11 o'clock, okay. The fact that you developed such a low sugar at that hour of the morning, it was what time? About 3, 4 o'clock?
No, just before Fajr, which is about 5 o'clock.
Or before Fajr, yeah. So you found it to be very low?
Yeah, at 4.8.
Yes. Now, just in general principles, obviously we need a lot of time with consultations. First of all, I would suggest that your doctor has obviously recommended correctly, because the long-acting insulin is to be taken at nighttime, and maybe what you can do in order to ensure that you don't get those early hour lows, you should take your long-acting insulin a little bit earlier in the evening. Or you can even change it to the morning. Okay? Which may be safer. Yeah, you can take that in the morning or in the evening, okay? Now, the important thing is that you don't want to get those low sugars while you're sleeping, because you could obviously go into a coma. And that's the biggest fear. So change the time of your long-acting insulin, and your doctor is absolutely correct when he says that the long-acting insulin, you are guided by the fasting sugar. If the fasting sugar, by the fasting sugar I mean when you get up in the morning, before you have anything to eat, you check your sugar. If that fasting sugar is high, then you need to increase the long-acting insulin, okay?
Okay.
So the long-acting insulin, the question is what time should you take it? You might have to work that out with your doctor. Secondly, the fact that your A1C is 12%, is that what you said?
Yes.
That's extremely high, and I would say that somewhere something is not right. You might even need to go to see an endocrinologist or a diabetic specialist, if you're not seeing one, to try and see if they can work out exactly how to manipulate your levels. But I would suspect that actually your sugars might be rising, especially after your meals. Now, if you can check those 2-hour glucoses after the meals, and we pick them up as being much more than 8 or 9, then that probably is the cause of concern. But first and foremost, we always say get the fasting sugar corrected, and then work aggressively on the post meals. And don't forget your weight reduction. Don't forget your exercise program. So I think that you, sister, need to see, number one, a endocrinologist or a diabetic specialist, who must in turn refer you to a diabetic educator. Whilst I do admit that you're obviously an intelligent person, we're all clever, even nurses tell me, but I know everything about diabetes, but it's amazing what can come out when you have one-to-one with a diabetic educator. You need to see a dietitian, and you need to see somebody as a biokineticist who can help you and teach you to do the correct exercises without harming your body. So sister, I think you need team effort, and I think you should be aggressive, a little bit more aggressive than you are at the present moment.
Jazakallah khair for your call, sister. We're going to take an ad break now, and we'll take calls again after that. So a short ad break, and then you call back on 011 086 7701 or 2 or 3. Assalamu alaikum. Welcome back to Health Matters, a comprehensive chat by the Islamic Medical Association. We're discussing diabetes today. Time has gone past. We got one caller, and we'll continue with that, and then we'll be closing up shortly. Assalamu alaikum wa rahmatullah. Assalamu alaikum. Okay, you seem to have lost that caller. The line is 011 086 7701 or 2 or 3. Haroon, look, we spoke about... The caller is back. Assalamu alaikum.
Good evening.
Good evening.
Good evening. My name is David Irons. I'm speaking to you from a little town called Ubombo, northeastern Zululand. Right.
Welcome.
Are you there?
Yes,
welcome, welcome.
Right. Okay. Let me put it to you. I am a type 2 diabetic, and I have recently found there's a very close relationship between diabetes and wheat. Can you expand on that for me?
Diabetes and what?
Wheat.
And wheat.
You're not talking about dacha, eh?
No. I'm talking about wheat. You know, bread.
Yes.
All the gluten products.
Yes, yes.
Can you expand on that for me?
I don't have much to say except to say that basically there are people that are gluten sensitive, not necessarily diabetics. But there is a theory amongst the homeopaths and the other practices in medicine that actually do recommend that people stay away from a gluten and wheat diets to improve their general health. In terms of diet,
correct.
I beg your pardon?
Yeah.
That seems to be a general trend, and people seem to lose weight with that. It's also a weight reduction form of diet, which because of the weight reduction, it will obviously help the diabetes, because as we have explained, the obesity or the excess weight is one of the causes of the insulin resistance, which prevents the insulin from carrying out its action of moving the sugar into the cells. So that may be the method in which it may be working. Are you aware of any other concept on that regarding
I just have to say in my own personal case.
Yes.
I take 1,000 milligrams twice a day of metformin.
Yes.
But that I couldn't get below 9 and 10. 10.5. I really battled.
Yes.
And I went on to the gluten-free diet.
Yes.
And I dropped down to the 6 and 7s.
And did you lose weight on that diet?
Yes, I've lost a lot of weight. I've
exactly.
lost about 7 kgs.
Exactly.
And suddenly, as it is put, I'm a man of 74 now. Suddenly I'll see what I have missed all my life.
And you're now rejuvenated.
Rejuvenated.
Excellent.
And I've gone through life. Everybody's treated the symptoms.
Yes.
They've never treated the cause.
Absolutely. So this is what we are trying to do tonight to all our viewers, trying to explain that the major cause, would you agree, was the obesity.
Yes.
And that if you
That's right.
The obesity and also activity. Today we've got too many people that are sitting by as couch potatoes, or who are sedentary, or whose work is so full of stress they don't have time to exercise, they don't have time to move their backsides off their seat, etc.,
That's right.
etc. So you would be one of those that would support us, I hope.
Thank you very much.
I support you 100% because it's, you know, I myself have found a lot of people who are responding to gluten-free diets.
Excellent.
Perhaps
So-
you
I
could
even had a case the other day with a case of gluten poisoning.
Yes, there is gluten
Yeah,
is
that
a
also
substance.
arose.
Yes, gluten is a substance that needs to be looked at very carefully. So thank you very much for that. We appreciate your call.
Thank you very much for that call, and perhaps we could explore that particular gluten issue on another program. We're going to be wrapping up just now, and time has gone by. The lines are now closed, so we've got a few minutes left, Haroon, just to perhaps touch on why are we going through all of this. We want to prevent complications, right? So just perhaps a quick wrap up on the complications, and maybe on another day we'll be discussing more on diabetes and its impact.
First of all, I just want to stress to the young females, those of you that will be getting married, and inshallah you will be procreating and you will have children. It is important that you investigate your situation before you get married and before you fall pregnant. Because if you have a family history of diabetes, and especially if you are also obese, then you are vulnerable and you are a potential diabetes in pregnancy. Diabetes in pregnancy is not such a major complication. The problem is that if you are diabetic in pregnancy, that baby is growing in an environment of sugar. That baby will be a large baby. But more worse than that is that that baby has the potential to develop diabetes. So if that baby is a male, that's not too bad. But imagine if that baby is a female. She, in turn, becoming a diabetic, will procreate and produce more diabetics. So what are we doing? We are breeding diabetics. So young females, please take this as a serious warning. And parents, those of you who know you are diabetics, you've got the daughters, advise them. Secondly, why are we so worried about diabetes? Because unfortunately, diabetes is not a condition that just raises your blood sugar and makes you feel weak. The problem is that diabetes has got other complications where it is associated with abnormalities of your cholesterol. And as a result of all this combination, what we call the metabolic syndrome, you develop hypertension, you develop hypercholesterolemia. As a result of that, the arteries of our bodies block up. You've got arteries, major arteries going to the brain. If that blocks up, you get a stroke. You've got arteries going to the heart. If that blocks up, you get a heart attack. And diabetics are very prone to both of these. You've got blood flowing to the kidneys. If that blocks up, you go into kidney failure and you have to go on kidney machines. And today, the commonest cause of kidney failure, I'm telling you as a nephrologist working with patients on dialysis and transplantation, the commonest cause today is becoming diabetes. Then you know you've got 2 legs and 2 arms. There's blood flowing to each of these. If you don't control your diabetes, these arteries get blocked, and you know that the commonest cause of gangrene and amputation of the legs and the feet is diabetes. We can prevent all of this, but only if we work together as a team. I mentioned all those. First of all, you, the most important member of the team, to understand what we're talking about. And I mentioned the diabetic educator, I mentioned the dietitian, I mentioned the physiotherapist or biokineticist, and the specialist who can handle your diabetes. So I think any of you that have diabetes and you have not been able to answer your questions here, please go and ask your general practitioner to refer you to this team. And I promise you that inshallah you will do well.
Jazakallah khair, Haroon. We've reached the end of the program. Time is up for us. We'll probably call you again for discussing the diabetes. A huge subject. We've barely scratched the surface, but hopefully we've answered some of your questions. We've agitated your thought processes to go and seek help, and prevention is the key. Next week, we're back here. We'll be discussing colon disease. So we'll see you again next week. Jazakallah khair to all the viewers for joining us tonight. Assalamu alaikum wa rahmatullahi wa barakatuh.